Hi, this is Christina with Questions for Nursing, and I'm reading stories on Reddit, nursing stories. Okay, this one said, I worked 11 to 7 on the ortho neuro floor back in the day. I had a dementia patient in restraints who was yelling out consistently. The only empty bed was in his room, and we were getting a young male admit with a C-spine injury. It was 4 a.m. after I finally finished admitting the young man. His roommate was still yelling even after being medicated. I went to the nurse's station to check the station to chart, and after a few minutes, I heard nothing. The hall was quiet. I walked down the hall to check on my yeller and did a double take. There he was, still in restraints with a piece of white cloth tape across his mouth. I looked over at the young man. He just laid there smiling. I said to him with the straightest face I could muster, "You can't do that." He said, "I had to shut him up somehow. Note to self, don't leave dressing supplies in a room with a yelling patient." Oh my gosh. Oh. So I've never seen this done, but I've had rooms where there's roommates where one roommate's yelling and the other roommate is threatening to do things to them if we can't calm them down, but I've never actually seen it happen before. The most I've ever seen happen in a double room was where one of the patients would get the one who was awake would get up and stand at the edge of the bed of the other patient yelling and just scream at him. I mean, it's hard for people who are not in the medical field to understand. Sometimes people don't know what they're doing. When they're yelling, they don't understand it. It's just an unfortunate piece of humans. So, gosh, that's funny though.